There are many misconceptions about osteoarthritis, and in this video, what I hope to do is provide you with some food for thought, and more importantly, a little bit of hope. So there's this law referenced on Wikipedia called Brandolini's Law. It's also known as the bullshit asymmetry principle. It states that the amount of energy needed to refute bullshit is in an order of magnitude bigger than that needed to produce it. In other words, once somebody is given incorrect information and they believe it, it takes more effort to change their mind than it would if they hadn't had any opinion to begin with. Now, before we progress any further, I don't want you to take the message of this video to be one of me criticizing any profession or anybody in particular. I want you to view this as a message of hope. Look at it through the lens of like rose-colored glasses, the lens of hope, right? The lens of, hey, you're not at the end of the road of your osteoarthritis. It's not a downward trajectory. It's not some inevitable process that you're going to need a joint replacement, right? So back to this Brandolini's Law where, you know, it's much more difficult to unconvince somebody of some incorrect information that they might believe rather than to give them information and have them believe it when they didn't have an opinion formed yet. Unfortunately, that's the way it is with osteoarthritis and imaging. Now, there was a recent study done in Australia with all these people that were on a waiting list for joint replacements, for knee replacements, particularly because of osteoarthritis. And every one of these patients, when they were looking at their identity about what their osteoarthritis was, every one of them believed that it was bone on bone. In other words, it was a structural issue. Now, as I've mentioned before, the pain associated with osteoarthritis has much less to do with the structure than it does to do with the inflammation, right? So what that means is that there's no healthcare professional that should be prognosticating about your osteoarthritis based on an x-ray. They shouldn't be telling you that you need a joint replacement based on an x-ray. They shouldn't be telling you that, 5 or 10 years from now, you're going to need a joint replacement. That just creates fear and catastrophizing in the person receiving that information. Now, I know this statement may be completely different than what you've been told or what you believe. So rather than just taking my word for it, let's look at some studies on the topic. And yes, I know I'm not supposed to do this, but I'm going to do it anyway. I'm going to read off the screen. So whatever, here we go. Annals of Rheumatic Disease, 2018, opens their paper by stating, quote, despite considerable effort, the existence of pain has not found to be strongly correlated with radiographic osteoarthritis, or OA. So by the way, in this video, when I say OA, I mean osteoarthritis, right? 2 syllables is way easier than 6. Current Osteoporosis Reports 2018. It's widely recognized, however, that there is a poor correlation between severity of disease based on plain x-ray changes and symptoms of pain. Psychot Journal 2019. They say, the discordance between clinical and radiological features of OA of the knee found in our study is keeping with multiple previous studies. So speaking of a discordance, a lot of people will say, but my doctor looked at the x-rays and it was clear that I had osteoarthritis and I needed a joint replacement. Or my doctor looked at my x-rays and he was sure that I was going to need a joint replacement in 5 years. So let's take a look at the research on that. Journal of Orthopedic Translation 2024. Unfortunately, the existing radiological examination is limited to grading the disease's severity and is insufficient to precisely diagnose OA, detect early OA, or predict OA progression. So yes, they're saying you can look at the severity of the structural aspects of it on an x-ray, but an x-ray should not be used to diagnose osteoarthritis or predict the progression of the osteoarthritis in saying like, oh, I predict in 5 years you're going to need a joint replacement. Okay, so why is that? Why can't you use an x-ray to diagnose osteoarthritis? Well, because of the simple fact that there's an abundance of studies that have taken x-rays of people with no pain. Just as a study, they just take x-rays of people with no pain. And there's a very high prevalence of osteoarthritis in those patients. As opposed to people who come in with pain and you do x-rays, there's also a lot of arthritis. So how are you to say that the arthritis that those people, or the pain that those people are suffering from is due to arthritis when there's a very high percentage of people who have arthritis who don't have pain, right? And what percentage is that? It's really high. The British Journal of Sports Medicine, 2018. The prevalence of knee osteoarthritis features on MRI in otherwise healthy, asymptomatic, uninjured knees is high, up to 43% in adults over 40 years old. So let's say you have some knee pain, you come in, we do some x-rays, and there's arthritis. Is it logical to say that your pain is due to the arthritis? Yeah, until you realize that 43% of people without pain also have arthritis. How do we know that your pain is from the arthritis? So what's the driver of pain in arthritis if it's not structure? Well, it's inflammation, right? If you have systemic inflammation throughout the body, then the joints are also going to be inflamed, right? And whether that's from a poor diet or gut dysbiosis or a low-grade infection or chronic stress or sleep disorders, or you have a gluten sensitivity or something like that, that is going to drive inflammation through the body. Another more common example is just fat mass, right? Obesity. Fat cells, called adipocytes is what they're called technically, they create inflammation. Fat cells actually secrete inflammatory chemicals. And so the more fat mass you have, the more inflammation in the body you have, and the more pain you have in your joints. Not necessarily because of the mechanical weight of your total body weight, but because of the inflammation that the fat cells create, right? So osteoarthritis and cartilage, 2013. The risk of hand osteoarthritis is increased twofold in obese patients. This increased risk cannot be explained by the mechanical effect of overload, but can certainly be explained by the systemic factors released mainly by abdominal adipose tissue and able to reach and then activate joint cells. Another paper from Osteoarthritis and Cartilage, 2014. Both fat mass and fat percentage were positively associated with knee OA in men and women. The same was observed for skeletal muscle mass, whereas skeletal muscle percentage was negatively associated with knee osteoarthritis. In other words, the more skeletal muscle you had, the less knee osteoarthritis you had. This suggests that especially a high fat mass relative to a low skeletal muscle mass is unfavorable. So again, the point of this video is to create hope, right? That study that I mentioned at the beginning of this video where they interviewed all those people, the main belief that they had was bone on bone. And the authors of the study say that was one misconception that really led to what's called catastrophic thinking. In other words, people had no hope, right? They just felt like it was inevitable that they were going to have a joint replacement, which we know is fake news. So rather than be scared off by what you see on an x-ray or what someone tells you, let's try to be more optimistic, right? Let's try to maybe reduce inflammation in our body, lose a little bit of fat, get some exercise, and see what happens then, right? Because as I've said in the past, your health is in your hands. All right, take care. We'll see you next week.